But Guy, I wanted to bring this up also because here in the U.S., it feels like we got that warning yesterday from the CDC director, but then you have a lot of states opening up, and you have a lot of states opening up vaccinations. Case in point, I'm still waiting to get my vaccine, even though I'm not eligible in New York. And this chart, I feel like, really exemplifies that. The white line are U.S. vaccination cases, and then the orange line are confirmed COVID cases. And you can see how they're both sort of rising in tandem, and they're now sort of at the point where vaccines can cross infections, which will be huge for the U.S. So let's break that down a little bit more with William Schaffner, Vanderbilt University School of Medicine professor. Professor, thanks for joining us. In the U.S. in particular, do we see vaccinations beating out cases confirmed? Can we get there soon?
Yeah, well, Alex, it's a race, right, between the vaccinations and the spread of the virus, particularly with the new variant strains that are even more contagious. So we're rolling out the vaccine. More and more people are eligible across the country. I think you in New York will be eligible. Anybody who wants the vaccine can get it probably next week. That's certainly going to be the case here in my state of Tennessee. But we're already running into people who are reluctant, hesitant. There are parts of our state already where the vaccine is remaining in the refrigerator rather than getting into arms, and the virus is spreading.
I hope you're right. I hope next week anybody in New York that wants it can get it, because we've been dealing with that issue today, William. Let's talk a little bit about that. The demographics here. So the further you go down into the younger cohorts, I'm assuming that hesitancy goes up. Is it hesitancy, or they just don't feel a need to take the vaccine as a result of the fact that their parents and grandparents are now protected, and as a result of which it isn't such an issue for the younger cohort because, well, if they get it, they're unlikely to suffer from it?
I've heard all of those things. And another thing is that in rural areas where the folks haven't really accepted wearing masks, there's still a political overlay to all this. And the ominous thing is that we're seeing this uptick in hospitalizations, and many of them are in young adults going all the way down to 20 years of age. So those young adults aren't affected as seriously, but you can still get very, very sick from this virus, even though you're young and healthy.
Nevertheless, it seems like the market is very much following the idea of vaccinations, reopening, and that positivity. It's very different over in Europe. What are you making of the AstraZeneca drama with thrombosis over in Europe right now?
Well, I thought it had been put to rest, but apparently not entirely. You know, the European Medicines Agency said, go ahead and use this vaccine because the risk is very, very low, and the risk from COVID itself is very high. And so they made that public health assessment and reauthorized, if you will, or reinforced the notion that AstraZeneca should be used. I think one of the things that will help down the road is when this vaccine comes up before our own Food and Drug Administration, and if it gets an emergency use authorization, which we think it will, that will reassure many ministers of health around the world.
I'm curious, Professor, as to what happens in the fall. Am I going to need a third shot at that point, or a second shot, depending on whether or not I've had the J&J shots? What is your assessment of how this progresses from here? Because I'm starting to hear talk about that. I'm starting to hear talk of the fact that come September, October, we're going to be onto that already.
Well, Guy, you're curious, and so are we. We haven't made that decision yet. A lot depends on how active these variants are that are sufficiently different, for example, the South African and the Brazilian variants, who don't respond as well to the vaccine. And if they start to pick up steam, then we may well see that we'll need not only a flu shot, but also a COVID booster shot this fall. We're not there yet. So hang on. We're still trying to get a first dose into so many people.
Yeah, I know. Why can't I get my appointment? Is there not the available supply, or are each state just doing things so differently?
Well, supply is becoming much more regular, such that at least in our state, we're opening things up. But until recently, people were not so sure about the supply, but I think the supply issue is being solved so that county by county, we're opening up to anybody who wants it, who's over 16 or 18 years of age. And then, of course, this fall, apropos of one of the things that Guy just asked about, we hope we can start vaccinating children, high schoolers down to grade schoolers and even beyond.